Welcome to the Hawaii Health Information Exchange Community Health Record. We log on by accessing the website through https://chr.healthenet.org. Usernames are unique to each user and will be provided by the Hawaii Health Information Exchange. Standard password on initial login is HHIE at HHI3. Put in your initial login. For the password request, you will be required to change to the initial login. Password requirements are 8 digits, 1 alpha, 1 numeric, and 1 symbol. You have to change your password every 90 days. You can't repeat any of your last 5 passwords. And there is also a password reset from the login screen. After you log in, for the initial term, you'll accept your EULA and password. You scroll down through the EULA in order to activate the accept button. You click, change your password, set your security questions, and then you get into the main page. You can see that we have the patient search bar, we have the results inbox, referrals, we have name on the top, and obviously the disclaimer on the left for Medicity, Hawaii Health Information, and Health eNet. First, we start off by conducting a patient search. It is a 2-step process. First, we want to locate the patient, and the second is to actually bring the patient into focus. Patient search can be based on any of the following elements. You can select by patient name, 1 or more letters from the beginning of the last name, medical record number, 1 or more digits from the medical record number, social security number, full or the last 4 digits, and the date of birth. You can use month, date, and year format. To positively identify patients, this is done by using the patient search results, which positively match patients based on complicated matching algorithms. These algorithms consider identifiers such as name, sex, date of birth, medical record number, social security number, address, telephone number, and zip code in order to positively match a patient. If a patient is positively matched, the 2 files are merged into one and a plus sign is visible. We will do that by conducting the patient search. As you can see, you have the different sections here that we went over. The plus sign. This ensures that matching is only a true match. As a result, patient Sam, Sammy, and Samuel, for example, are all recognized as the same individual based on non-name criteria. If a patient is not positively matched, then the separate files are not merged. In this case, it's not Sammy, Sam or Samuel is Test, BMW, and M, Jackie. HHIE, Hawaii Health Information Exchange errors on the side of caution and merges patients only on algorithms with greater than 95% confidence. As a result, you are much more likely to see duplicate patients rather than improperly merged patients. Access additional records. Access to records is based on the user's role and previous association with the patient. Providers are automatically associated with patients when they order tests, are CC'd on results, or write notes in the hospital. Users mapped to those providers then have rights to view that patient's information. If the patient hasn't been previously associated with the provider, then they will need to access additional records to view the patient's information. The ability to view patients with whom the provider does not already have an association is dependent on the user role the user was assigned. Emergency department providers will only need to access additional records when looking for confidential results. Established providers have the ability to access additional records and to establish relationships with new patients. Staff with query have the ability to access additional records but not establish relationships. Staff without query do not have the ability to access additional records or establish relationships. As a user, you are required to select the reason for completing an expanded search from the drop-down box. The reason should be consistent with why you are accessing the patient's chart. Some of the main reasons include the patient is new to my practice, as we will see here, or I have an established clinical relationship with this patient. After the search is completed and the desired patient is chosen, the patient is brought into focus and the patient summary appears. While the patient summary is the default landing page, we want to talk about the standard pieces before moving into the summary. The Face Sheets button is addressed specifically because it is high yield for practices and generally immediately provides information that the practice did not already know. This additional information grabs the user's attention and engages them with the product. A header will appear at the top of every page. It includes basic patient identifiers, the facility where the information is coming from. The header remains when scrolling down through the chart so that the user can always see which chart they are viewing. Demographics includes the patient's name, gender, and age. It also shows 30-day readmission notification. If it is within 30 days of the patient's last hospital discharge, the community health record will indicate this as less than 30 days in red. It also has breadcrumbs for easier navigation. It also has a results inbox, messages, referrals. The Create Care Summary tab creates an exportable copy of the full patient record, similar in content to the current Meaningful Use Transition of Care. We click on the Create a Care Summary, which creates an exportable CCD, also known as a Continuity of Care document. It is very comprehensive, and in the future development, you will be able to build your own care summary. We click on Preview. And you can see the electronic health record information populated from the Create a Care Summary. The Profile and Face Sheets tab. This tab provides access to both patient demographics and also the specific face sheet. These pages contain basic information about the patient encounters, and it is high yield for the practice. We can see the demographics. It contains information including their address, insurance information, and also includes different aspects of the patient's demographics, such as the patient consent, the patient demographics, emergency contact information, etc. The amount of information available varies by the data source. For example, labs do not submit as much information as possible. On the Face Sheet tab, it is one of the most successful tabs in the community health record. It is high yield for the practice and provides easy recognition of how the patient has accessed care and why. Clinical information includes the location, visit dates, admission and discharge dates, associated providers, problems identified, and procedures completed. Filters are present at the top of each page. Filters include all, emergency department, inpatient, outpatient. May also filter by clicking on top of columns and charts. Filtering is especially important for the medication query. Patient Summary tab, which leads us to where we first started. On the Patient Summary tab, you can find items such as problems, conditions, medications, results, allergies, procedures, reports, care summaries. The user can drill down by selecting all under each category for full data. Summary page is customizable from gear icon to the right of the screen. The Encounter tab. It contains two parts. One is the problem list, as well as the encounter history, as you can see from the screen. The problem list displays all problems identified on each source. No records to display means no data was sent by the data contributors. It does not mean the patient has no problems. Problems appear directly how data sources send them. Problems are sortable by clicking on header. On the encounter history, it displays all the encounters the patient has had with the community health record data contributors since the data contributors started sending overall data. It is also organized sequentially, starting with the most recent visit. Data appears how it was sent by specific contributing organization. Encounter data may include date, ambulatory setting, inpatient, emergency department, any problems, or they might be directly linked to the face sheet. Results. The Results tab is the second most commonly used area of the CHR. The naming results may be confusing to some users due to the tab containing more than just lab results. Results include any type of report, result, or note contributed by a data source. Specific results include lab results, pathology reports, radiology and imaging reports, cardiac studies, EKGs, echoes, stress tests, consult notes, history and physicals, progress notes, discharge summaries. Results display as provided by the data contributor. Same content as what now faxed. Almost real time. Timing determined by data sender, but generally sent after note or result assigned by the attending provider. Only final results are available in the community health record. Results are filterable using the toggles, Googling for a result, or by clicking on the headers. The Medication tab. The Medication feature is used for viewing allergies, medication fill history, and medication alerts. There is also the capacity to view inpatient medication orders, but the Hawaii Health Information Exchange is not currently using this field, so it is turned off. Allergies. Allergies listed are contributed directly from the data source. Absence of allergies does not mean no known drug allergies, but rather only that no allergies were contributed from the data source. Medication alerts. Medication alerts are based on the medication fill history. Alerts are meant to be identified with possible problem solution. Specific alerts include drug-to-drug interactions, duplicates in therapy, and possible non-compliance based on fill history. On the Query Medication History, the tab provides on-demand information about the prescription fill history. You do so by clicking on the Query Medication History. The purpose is to help bridge medication knowledge gap. This includes the difference between what is prescribed and what is actually filled. Patients getting care and prescriptions from multiple providers. Provides a 12-month medication fill history. It also shows the last query time provided at top of results. It It provides a complete on-demand query by selecting the query medication history. A single patient can only be queried once every 24 hours. Usually takes about 60 seconds. Users should be cautioned that queries cost the Hawaii Health Information Exchange and should only be repeated as truly necessary. This data includes medication name and strength, quantity dispensed, fill date, prescribing provider, which depends on the availability of the data source. Also, the pharmacy filled. Again, this depends on the availability for the specific data source. This tab also provides data quality and sources. This include but are not limited to the healthcare systems, as the data includes data from over 20 local and national pharmacy benefit managers, insurance companies, and pharmacies. SureScripts is just one of their data sources. About 90% of patients have some results returned. Results are also returned in alphabetical order. Need to sort it by the last fill date for easier use. It also has a print feature alphabetically. The Documents tab. This function will be used to access and generate continuity of care documents. The CCD repository includes the CCD being created and downloaded for incorporation into the provider's electronic medical record. Future Development Documents tab will also contain continuity of care documents contributed by community data sources. Specific sources may include farm-to-farm medication reconciliations, ambulatory visit summaries. To find external documents, you can click on the External Documents tab, and this is a specific query to receive continuity of care documents that may be available on demand from other providers or data sources in the community. Hawaii Pacific Health will soon be contributing data on demand in this fashion. Results Inbox. Notification of new events or results, such as a discharge from the hospital, are in this tab. The inbox is custom to what the user wants to see and is maintained by the user. All users by default have it turned on, but can turn off through Preferences tab. All users by default, each inbox is separate. There are no shared inboxes. Delivery based on associated provider as ordering providers or CC'd. Specific available information includes admission and discharge, face sheet notifications, lab results, radiology reports, transcribe reports, discharge summaries, console notes, and other clinical documents. To access the results inbox, you can go to the home search page. The number and e-results appear on top of the results inbox tab. Once you click on it, as we did, it opens up the tab. Unviewed results appear in white, including the date and time of the result, patient name, date of birth, type of result, description of result, alerts, ordering provider, and resulting facility. Click on a patient to view results. Results will appear below. Access complete community health record through view results and patient record link within the result itself. Printing available or download to PDF. Select remove from list after viewing and or printing. Results will only stay in the inbox for 30 days. However, it is best practice to delete messages after viewing to prevent message accumulation, which will result in sluggishness of the system. Maintenance, as it relates to results inbox, is managed by the individual user through the user preferences by user's name in the top corner. User needs to periodically check setting and add any new data sources. Click on arrow by username and select Account Preferences. Within Account Preferences, select Delivery Rules. If user wants to turn inbox off, select Remove until all rules are gone. Then select Save and Exit. To update delivery preferences, select Edit on the rule chart. Within Delivery Rule Detail, verify all desired data types and sources are checked for both inpatient, outpatient, and confidential patients. Available data includes general cardiology, interventional radiology, and cardiac catheter lab, face sheets, laboratory, radiology, medical transcribed reports, consults, discharge summaries, and pathology. Advanced delivery rules allow access higher frequency of results. Highly recommend users only select the following: admissions, discharge, abnormal, normal, critical, stat, routine, final, corrected. Do not select pre-admission or when update is received, or a user will get inundated with messages. Select Save on Delivery Rule Detail. Select Save and exit from account preferences.